Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello,
Rhonda.
Hello, David, and welcome to all of our listeners around the world and throughout the galaxy. This is the Feeling Good podcast, episode 380. We have a special guest today who's been on our podcast before, and we've really enjoyed her and learned with her, Taylor Chesney. So welcome to Taylor.
Thank you. Thanks for having me. Excited to be here.
And where are we on the calendar right now for number 380? What day is it today?
Today is January 22nd of 2024.
January 22nd. Okay. Wow. Time's moving fast. I thought it was a week before Christmas.
No, that's way past Christmas. And so Taylor is the director of the New York office of the Feeling Good Institute, and she's a clinical psychologist. Taylor reminded me that many people want to learn more about how to work with children and teens using the team therapy, and she runs an ongoing consultation group that meets monthly about that topic, and we're going to list how you can join it if you want in the show notes.
Yeah, I'm especially happy to hear that your training is ongoing. I thought it was just every now and then, but I'm always telling people who work in that age category, make sure you go to Taylor's training, but this will make it much more convenient for people.
Yes, thanks, David.
Yeah.
Yeah, and Taylor, in case people don't read the show notes, what's your email address?
Sure, it's Taylor, Taylor, at feelinggoodinstitute.com.
That is correct. You got it right.
Well, let me read this very brief endorsement that we got from India. Someone wrote David, "Hi, David. I'm Shushma from India. I have been a small group leader in some of your trainings. Of course, you wouldn't know me. I've been drowning happily in Team CBT, and look at what I found. I was looking for this book because I thought it would be a great way to learn about group therapy and team. It's not easy to get this book, but this copy made me smile. You even signed it exactly 30 years ago.
Wow.
So sincerest regards and love, Shushma."
Yeah, that's fantastic. And that's the leader's manual for 10 days to self-esteem.
Yeah.
Which is very rare.
And we're going to post a picture of the book and your signature for her.
And yeah, awesome. So thank you for being with us on the show today. And we hope you're all doing very well. This is the shortened version of the podcast.
Oh, so Taylor, you know, in ignoring David, in September, you taught a free 1-hour class, which you do occasionally, on Team for Anxiety in Children and Adolescents. And I'm so proud and happy that I took it because I always learn with you. And you talked a lot about how you work with children and teens when they're coping with depression and anxiety, and how you work with their parents. So I was just hoping that you could share that again with our podcast listeners.
Absolutely. I'd love to.
Can you cut it down to maybe 2 sentences?
Sure. Lots of kids have anxiety, and it's hard to deal with.
That is jaw-dropping. Okay, David will now shut up so we can start to learn some cool stuff.
So, Taylor, what's the age range of kids and teens that you work with?
In general, I work with kids as young as 6 and teens up and through young adulthood is sort of my bread and butter, what I work with most of the time. and based on their age, to a varying degree, their parents as well.
Uh-huh. So,
age 6 to what would you say?
In general, in my practice, I treat adults as well, but 6 to 18, I feel like I work mostly with the children, teens, and their parents, and then older than that, functioning as adults. So,
yeah, cool.
So a 6-year-old isn't going to call you; their parent will call you. Probably 6 to 18-year-olds won't reach out to you; their parents will. What's the first step in working with them?
First step in working with them is to first do an intake and to figure out what's going on, doing some testing, figuring out what their symptoms are, empathy, figuring out how we could connect with them, how we can get to know them, how we can develop a relationship with them. And then really most important is agenda setting, which is where we figure out who wants help and what they want help with. And this is, I think, where therapy with children and teens gets much trickier than with adults. Because Rhonda, as you said, it's likely not the 6-year-old picking up the phone, Googling me and calling me. It's their parents, it's the school that's concerned. And so really the first step of setting up successful treatment is agenda setting and figuring out who wants help, what they want help with, and are they willing to do what it takes to get better? And also, what are some of their good reasons to continue to be anxious or depressed, or what it says about them? That's really great. So how I get started and figure all that out is through an intake where I meet with the child or teen for 2 sessions, and then I do a session with the parents to figure out how they're doing, how they're coping with their child, how they're seeing what's going on, and really figuring out who's going to do the changing and who's going to do the work. And then we end the intake session with a wrap-up session where I kind of let parents know how I think I can be of help and what work needs to get done.
So is this initial one, say, with the child, or always in that age group with the parents and the child together in the room with you, or not?
In general, I meet with the child alone.
Oh, okay.
Making sure that I can connect with them, relate with them, that they can separate from their parents, and that we could be successful in treatment. The parent intake session would be with both parents before treatment starts.
And you meet with the child before you meet with the parents?
Depending on the age. So a child, or probably anyone up until about 11, I'll meet with the parents first so I can gather lots of information from the parents and hear their side of it. I find that they, in general, have more helpful information than the child, but kind of 12 and up, the teenagers, I like to give them what I say first crack at me. I find that for building a relationship with them and having rapport, it's really important that they feel like they get to tell me their side of the story before I've been corrupted by their parents' side of the story. So I find that order is fairly important.
A lot of the team concepts, like the good reasons to continue being anxious and depressed, are hard for adults to figure out. How does that translate to working with 6 to 12-year-olds? Or can they figure out all good reasons to stay anxious and depressed?
Oh, absolutely.
Or angry.
Mm-hmm.
Yeah, absolutely. And I think with children or teens, I need to do a little more teaching of that. It's not first and foremost in their mind, but I teach them and let them know that both the parents have good reasons and the children. So I often let them know that I'll see someone that's a really good athlete or is a stellar student, but they're really, really anxious. And so at first, I'll teach them a little bit about what anxiety is and how it's actually really helpful. So do a little brain lesson. I'll tell them something that there's something called the fight or flight response in our mind that leads to anxiety, and that our brain sees something that's dangerous and tries to protect us. And that makes our body feel really anxious. And that's really helpful. And it's really good that our body can help us stay safe in that way. but that sometimes we see something that we don't need to be afraid of, and our body gets confused. And we don't want to get rid of that system. We just want to be able to turn it down. And so I'll use an example of, someone that has a math test. I'll ask them, what do you do when you have a math test? And what do you do before you have a math test? And they'll say, well, I study, I talk to friends. And I'll say, what about when you're really anxious about that math test and you don't think you're going to do very well? And they'll say, well, then I'll study more, or I'll talk to friends more, or I'll go for extra help. And so I'll say, that's great. So does it help you to feel anxious? Do you get better grades on your math test? And they'll say, yeah. And so I'll say to them, so that's a really good example of how anxiety is really helpful. It shows that you care about how you do, you prepare more. And so there's a lot of good reasons to be anxious. And then I'll ask them, but are there any things you don't like about the feeling of being anxious before your math test? And they'll say something, well, I can't sleep the night before, so I'm always so tired, I'll get a bellyache, I can't eat. And so that will help them see some of the negatives of feeling anxious. So with children and teens, kind of using examples like that can really help them understand the concept a little bit more, that anxiety both shows really great things about them, that they care about how they do on a test, and also helps them in some ways.
And then how do you explain depression with your children and teens?
So that one sometimes is a little bit more challenging.
Absolutely. Yeah,
right.
I imagine.
Yeah. And so with depression, right, we'd have to think, for example, of if you get really, and I don't always use the term depression when I'm talking to a child. I'll say, feeling bad or feeling sad. If they're older, I may use the term depression if they've used it. But I'd say something like, if you feel really sad when you're not invited to a birthday party, right? What does that say about you that's positive? Or why does that make sense? And they'll say things like, it shows that I want to be social, or I'd like to be with my friends, or, I care a lot. So using language that they can relate to really helps them start to see why some of these things may make sense or be good. And then eventually, if there's parts of it that they don't like and they want to work on changing.
I'm just writing this down, so I'm not saying much because I'm trying to get it down for my show notes here and understand what you're saying. Just to summarize that, to get across the notion of depression, you might use a word like sad or unhappy or down, and then why might you? How might you feel if you weren't invited to a birthday party? And if you're feeling sad, it would show that you value relationships and want friends and care about people. Did I get that right?
You did.
Mm-hmm. Sure. Okay. And then where do we go with this?
So as part of motivation, and sometimes I call it assessment of resistance, right? We figure out with the child, is this something that they're willing to work on? And do they want tools and skills to help change? And kind of explaining to them during the intake what that might look like. And for example, how I can be of help to them, right? So for someone that has anxiety, that would require both the parent and child to do some different types of work. The child would have to want to learn new skills. They'd have to want to face their fears.
And then do you give them homework?
I do, yes.
What kind of homework do you give a child who's coping with anxiety?
So I love the pandemic. It really picked up the pace of virtual therapy and to be really effective in therapy. And one of the tools that I found to be really helpful and awesome is a very simple Google document where I'll write down all the tools and skills that we've worked on in session. I could use lots of visuals, and I will assign homework within a Google document. So I use a daily mood log, the one developed by David, where we kind of made things very child friendly. I'll teach them about their thoughts and feelings and how to work through their anxiety. So one of the, just to kind of take it back to what I do in general, the first step generally, if we've agreed that it makes sense to move forward with treatment, is a lot of psychoeducation. I find with children and teens, as opposed to adults, like just even teaching them and their parents about anxiety and how to react to anxiety and how to talk about anxiety actually helps them cope with and decrease the symptoms a significant amount. And so the first step is always teaching children and teens and their parents about anxiety.
Okay, well, this is why I want to get down to some specifics.
Yeah.
Teach me about my anxiety so I can understand it and know how to cope with it.
Yes, exactly.
Like if like in my case, if I get anxious about a patient who's angry with me, this isn't exactly a child thing, although
right.
It would be common among children who have clinical practices.
Mm-hmm. Well, the first step is I'll tell a child, do you know what feelings are, right? We, as adult therapists, we assume, right, that kids know what feelings are. And so I'll really teach them a lot about what worries are, what anxiety is. And I'll have in my office, could have like an emoji chart that's very big with kids now, where they can just really get comfortable saying, right now I'm feeling sad, or right now I feel anxious or worried. And the tenet of cognitive behavioral therapy, right, that our thoughts, what we're telling ourselves, impact how we feel. And so that's really important to teach a child about. And I'll give them a very child-friendly example. And one that I just always sticks with me has always been, I'll tell a child, let's say, Rhonda, maybe you could be my child for this example, right? Let's say you got a 90 on an exam, right? What would you be thinking or feeling?
I'd be really excited and happy.
Yeah, you'd be really excited and happy. Why would you be really excited and happy?
Well, I know my parents would be proud of me and happy that I got such a high score, and that shows how smart I am, and that my work resulted in this really great score.
Yeah. So based on those things that you're telling yourself, you'd feel really happy and excited. But let's say you studied for about 20 hours and you didn't go to your high school prom and you needed a 95 to get into the honor roll or something like that. You had a whole story and you ended up with a 90 instead of a 95. And how would you be feeling then?
Oh, I'd be really sad, and I might be angry at myself, and I'd be ashamed.
Right. So that just goes to show you, we think we know what that 90 means or what that event is, but it's really what we tell ourselves about it that impacts how we feel. And that's sort of like the whole idea of what we want to work on and learn about, that we need to figure out what we're telling ourselves that leads us to feel really worried. And if we can change the way we think, right? This is nothing new in cognitive behavioral therapy, but if we can change the way we think, we can change the way we feel.
Yeah, this is great. This sounds like the beginning of our app for adults also.
Exactly.
Yeah, you feel the way you think, with similar example,
Mm-hmm.
and then the idea of cognitive specificity, but we don't use that big words like that. We try to keep it at the fourth grade level, more or less.
Right.
But exactly the same, to get people to see this idea that it's not what happens to you, but the way you think about it. And we've also learned, I've identified a good 10 or 15 variables in the app that we measure that have causal effects on the speed of and degree of improvement. And one of them is the degree to which they buy into the idea that your feelings result from your thoughts. And some people are still vehemently opposed to that notion, and they don't do as well in the app. And it's interesting how people have almost a religious zeal about, whether or not they believe that. Now, I would imagine that little kids wouldn't have such a preset, forceful notions, and maybe be a little bit more suggestible and easier to work with, maybe more fun to work with because of that. I'm not sure.
I would totally agree with that. And that's why I think the psychoeducation component works really well with children, to really teach them and their parents also about what's going on. And specifically also that a lot of anxiety is also caused by an attempt to escape or avoid an uncomfortable situation or feeling. And a large part of the therapy is to help them learn and be willing to enter into the feared or uncomfortable situation and learn something new about themselves or about the situation.
Do you have a story for that one too, or a little exercise for us, so we can come to see that anxiety is due to our urge to escape from a feared or uncomfortable situation?
Sure.
Not really.
I mean,
you do? Okay.
I was going to say I could just make one up, but Ronza and I were chatting about the podcast. The talk I did over the summer, and I always learn so much from my kids. But I was in the ocean with my oldest son, and there were these.
Who is how old now?
He is 9. Alon.
Oh my God! My goodness.
Yeah,
he's getting to be a big boy.
He is getting to be a big boy. Yes. And he was uncomfortable with these jellyfish. I forget what, he had a funny name for them. And he wanted to run out of the ocean. And I was holding him and I kind of just said to him, you feel uncomfortable and you're telling yourself that these jellyfish are scary and bad. And you can run away and not enjoy this, or you can stay in here and see if you learn something new. You may learn that they're really scary and bad, and then we should run out of the ocean to make sure that we're safe. Or you may learn that we can have fun while being a little bit grossed out by this uncomfortable situation. What are you going to do? And he was like, I guess I'll stay, right? And we stayed and had a really fun time. And I think that's an example, right, that without exposure, you can't learn something new. There's nothing wrong with feeling anxious. There's nothing wrong with feeling uncomfortable. I felt anxious before starting this podcast because I wanted to do a really good job. But then, when I am here with both of you, it feels much more comfortable and okay, and kind of learn that I don't goof up as much as I think I will. So I don't know if that's the greatest example.
I wouldn't jump to conclusions, Taylor.
Yeah, that's right. I should keep beating up on myself.
Yeah. So you're saying it's okay to be scared, but also okay to test your belief. But what was the truth about the jellyfish?
That they were awkward and uncomfortable and not our favorite thing or his favorite thing, but that there was nothing horrible and bad that required him to run out of the ocean. I think you would say something like, the beast had no teeth, right?
Mm.
Well, do they sting you?
They could, right?
Oh, I see. So It's nothing to be afraid of, son. It's just that don't touch them because they'll give you an incredible electric shock.
I like to toy on the edge of danger. So I think the lesson is that they appear scary, and our brain has a way of trying to protect us, and the fight or flight response kind of kicks in and tries to get you to run away, but you need to be willing to test
think it
out.
Through.
Yeah.
Yeah, cool. Nice.
Taylor, could you tell us the same dynamic with a child that approaches you who's suffering from depression? What's an example of how you would use psychoeducation with a child or a teen who's depressed?
Yeah. So again, I use the daily mood log as kind of like my anchor with a child that's depressed or anxious. And we'd want to start with a specific moment in time where they're feeling depressed. And so we could use I don't think they'd get depressed over the 90, so maybe we'll say like a 70, or assuming that they're not going to do well, get a specific moment in time. Like I got rejected from my top choice college, right? Maybe that's a common one, especially this time of year with college acceptances coming in, and we teach them to identify their emotions in that moment in time, and then ask them to identify some of their negative thoughts in that moment in time. So when you're feeling really depressed, you're telling yourself, I'm stupid, I'll never get into a college, everyone else is making fun of me. So really figuring out what are the thoughts behind their depression or sadness. And then from there, once we've elicited all those negative thoughts, we can pause with them and say, I'd love to show you some great tools or techniques to crush this depression and then make it go away. And at the same time, I don't necessarily want to do that without your blessing. I think the fact that you're feeling down from not getting into college makes some sense, right? And kind of is really important to you and shows some things that are really important to both you and your family. So with children and teens, I always include family and parents in that question, because it's not always just about the child's feelings, but also the lessons that they're hearing each day from their parents.
And do you use the magic button and magic dial with children when you're doing positive reframing? Yeah,
I do. Absolutely. Because I think it's important for them to see that nothing is just black and white. We're not just completely blowing their depression or sadness away. That I think, especially for children, it's really kind of comforting and teens to know that they can have some of that still, right? Just like adults, that we would never want to completely get rid of all their feelings, that there's parts of it that are really awesome and special about them that show their desire to do really well. Or
it sounds to me, at least, that working with teens is virtually identical with working with patients. I think with adults, I think that you might use simpler words if they don't understand a word and explain things in ways that they can understand. But it sounds like pretty much the same process, because you do all of those things with adults as well. And, adults often don't have the understanding of these things either.
I'd say, I'd agree with that. I'd say the one difference is also factoring the role that the parents play.
Well, that's what I was going to ask about, because we've had a couple other podcast guests who work with children or teens. Nobody you'd know, I don't think, but we had a really neat guy from Arizona who did video game addictions. And one of his many excellent points was that you've got to have a contract with the child, not the contract with the adults. And I'm sure you've heard this a zillion times since the first day of pediatric training in your graduate work, but that the parents, bring the child in for you to fix the child. and that's not gonna work most of the time. And you've got to be working for the child. And I don't know if you remember, Rhonda, but this might have been my small Tuesday group, but we had someone. I'm losing my voice. Well, that's not important. Might get me to shut up, which could be a good thing. But we had a woman in our Tuesday group who's had the patient was a little boy that was, I think, 5, and he hadn't been potty trained yet. And this was a great concern to the parents, but he had no concerns with it at all. And his goal was he wouldn't be potty trained himself until he was 6. And so that would be that kind of issue, I suspect, that maybe the parents are the mother is the one that needs to be treated. I'm just talking out loud, but maybe it's okay to have your goal to be potty trained when you're 6. Do you have to be working to talk the child out of this and talk the child into being potty trained?
I think there's certain situations where it's clear that the child's not going to want to work on it, but the parent has to decide how much, where they draw the line. I always try to be very respectful of parents and how much, what their values in their family are and what's acceptable in their family. What I know about a 5-year-old not being potty trained is it's unlikely that a public kindergarten would allow them to come without being potty trained. So I think it's up to the parents. Like, are they willing, or what are the consequences and how much of a problem is it? And something that happens a lot with anxiety or behavioral issues or potty training is how much parental accommodation there is to the symptom, which basically means...
Well, that's great, because she said every time they tried to potty train him, the mother would get anxious and rush to the store and get the kind of pull-ups or something, diapers, so he could, poop in them and then be cleaned up by her, which apparently he enjoyed.
Yep.
And so it has to switch to the parents in this case. And it's her anxiety that's kind of driving the system.
Exactly.
Oh, thank you.
You're so brilliant, David. You know all the answers.
Actually, I was just talking about myself.
Yeah.
So Taylor, that leads to an interesting question. What if you're in your assessment, you think, I don't see any anxiety in this kid I'm working with, but the parents, there's where the anxiety lives.
Yeah.
Then what do you do?
Yeah, I find it not often where a child's presented, for anxiety and there's no degree of anxiety, especially with like a highly anxious parent in that case. But if there's nothing in particular that I'm assessing to be something that the child's willing to work on and no place where it's causing significant problems, then I definitely will shift my focus to working with the parents.
Mm-hmm.
Cool.
Well, I remember when I worked with families and the child would overcome their anxiety. And then if I had a concern that they were going to go back into a very anxious family situation, that they would relapse pretty quickly and consistently if the parents are still feeling anxious or depressed, because kids are such emotional sponges with their family.
Absolutely. And I think, even if a child is highly motivated to work, there's a lot of great resources that I'll recommend. And I could share that in the show notes of books that I think are great for parents to read while their child is in therapy, because I could be the most skilled therapist in the entire world, but I'm only with their child 45 minutes to an hour a week. So parents really play an instrumental role in their child's recovery, as well as teaching them better responses to their anxiety or depression.
Okay, now we have a title for the show: The 3 Worst Errors Parents Make. And you will now tell us what they are and how to correct them.
Yes,
how about that?
I would love to. The first is, I don't have them written out in order in any way, but giving into a child's anxiety, right, is definitely one of the biggest errors that we see, right? We love our children and we don't want them to suffer. And so often, if they're suffering, we'll just jump in. Oh, you feel uncomfortable? Let's, go home. Or,
Oh, yeah.
you don't want to go into that party. That's okay, right? So, kind of shielding them from a situation that is really uncomfortable.
Or like
them.
the example you gave with your son, like, oh yeah, don't go in the water. It's too dangerous. It's scary. And that might teach him to fear being in the ocean for the rest of his life.
Right. Another error, I think parents.
Maybe let's slow down here. I'm a slow learner. Yeah. So how in that case? So you don't want to go into the party? Well, we can go home. So if instead of we can go home, how do you suggest we talk to the child? Like what's the Chesney secret sauce? Like I can guess what you would say, and then you can tell us if it's correct.
Sure. Guess what?
Get in there, you little brat.
You got it, David. You nailed it. You know me so well. Well, a slightly different variation on get in there, you're a brat might be, oh, this is going to be tricky. We're going to go in there and sit there together.
Okay, right? Cool. Yeah.
So kind of getting them to go in. You don't need to tell them, oh, it'll be okay, or you can do it. It's not so bad. You really want to avoid cheerleading or convincing them that it's going to be okay. You want to encourage them. Yeah, I don't know how it's going to be. Let's go and do it anyway, right? You don't want to try to reason with their anxiety, but rather stand firm that they can do it and that you'll be there with them.
I love that. Yeah, and let me just compare that to working with adults. Like you used to go with us on the Sunday hikes, and probably there were a lot of times that I was working with an anxious person on the Sunday hike, and instead of trying to convince them of something, like they had to have the assignment to go approach strangers and tell them that you're very shy and ashamed. And hiding it, and you're not going to be ashamed anymore, and you're not going to hide it anymore, and that's why you're telling them. Well, if you tell someone to do that, 100% of the time they'll refuse. But as you recall on the hikes, then I would say, no, you are going to do that, and let's do it together. And I would go up to someone we approach and say, my friend here has something to tell you.
Yes.
That type of thing. So just bring them into the experience, go into the experience with them rather than, arguing. Make it an experiential thing. Be firm, but in an experiential way. We'll go into the danger together.
Exactly. Feel the fear and do it anyway, right? Yeah. It's okay to feel that discomfort, but go and do it anyway.
Yeah, cool. That's great. Okay. That's the first thing. And by the way, if my new book, Secrets of Parental Training, makes millions on the bestseller list, then I'll give you a 10% cut
I can't wait.
Royalties. That might be your book, Taylor.
Yeah, one day.
Yeah, like the 5 worst errors parents make and how to avoid them and produce happy, confident children who grow up to be happy, confident adults.
Yes.
Well, Taylor, that example is really brilliant, because how many parents give into that caretaking? It'll be okay. We can do it. Let's go. But I love how you say, I don't know what will happen. Let's go in and see, and I'll be right there with you.
Right.
Yep, that's awesome. Okay. And even I could understand it. So I know that is taught super clearly. Now, what is the second most common error that parents make and how to avoid it?
I'd say another common error that I see is what we call the escalation trap. And what
escalation trust?
Trap.
Oh, trap. Escalation trap. Oh, yeah. Escalation trap.
So basically, that's a fancy word for saying, let their fear and their get really, really high, and then give in once they freaked out enough. So a kid says, I don't want to go, I don't want to go, I don't want to go. And they're kind of complaining all along, and you keep pushing them along, and then they freak out and start throwing a tantrum. And then you say, okay, we don't have to go. Right. So you've just kind of taught them that when their anxiety peaks and gets really, really bad, that we can usher them out and avoid the situation. And the reason that's so dangerous is because anxiety in all people, but especially children, works in a predictable way. And it goes up to a certain point and then comes down, right? Without doing anything. And so if all of a sudden when their anxiety is at their peak, we let them leave, they never learn that they can do the thing that they fear and be okay.
Oh, I see. Yeah. And then goes down. Now, can you give us an example of that? Like if the child is afraid of heights or afraid of cats or anything that.
Yeah. So kids afraid of a dog, and the parents are kind of well-intentioned parents think that, just throw a treatment at them, make them go near the dog, right? So the kid is kind of saying, I don't want to do it, I don't want to do it, I don't want to do it. And the parent lovingly holds their hand and says, oh, it's not a scary dog. Oh, it's such a cute dog. Go near the dog. And the kid's freaking out. And then the kid finally has like a full-on panic attack or starts screaming and throws a tantrum. And the parents are like, okay, it's fine. We won't do it. And they usher them away. And so basically they would have been better off not facing the dog at all than facing the dog and having a horrible experience and then ushering them to safety because they've learned.
You're teaching them that dogs are dangerous because you agree with them that it's time to pull away from the dog, and then they learn to keep avoiding the thing they're afraid of, which addicts them to avoidance because then they feel better. Is anger playing a role in, you say tantrum, that's usually an angry thing.
Well, I think they could be angry. There could definitely be anger, but I think sometimes there's a tantrum when a kid just feels so wildly out of control and their anxiety has overwhelmed them. I think probably there's definitely anger in any anxiety as well, anger that they have to be doing what they don't want to be doing.
Are they also learning that they can throw a temper tantrum as a way of controlling other people?
Absolutely. And that they can jump right to that big tantrum and then they'll get to avoid the situation that they don't want to be in.
Or maybe get their way on for something else.
Right.
Do you see these same patterns carrying over into adults?
Oh, yes.
Throwing
absolutely.
tantrums to get your way?
Yes. It's very, very pleasant as an adult to see them throw a tantrum.
It's what?
It's very pleasant. I'm joking.
Oh, yeah, pleasant. It is. Yeah, it's my favorite thing.
Well, really, what you're talking about, Taylor, which I love, is that the parents are teaching their kids that anxiety does not go away. Mm-hmm. And they're giving them positive reinforcement for that, which is really pretty strong to maintaining that behavior or that reaction.
Right.
Right. And now the first two errors that parents make both have to do with exposure and not, letting the children get away with not confronting their fears. What's the third trap? What's trap number 3? We've got trap number 2 is the escalation trap. And trap number 1 is the what's that one? Does that mean that's just giving in? But that's the same as the escalation trap. Number 1 would be the logical helping trap. Right.
Mm-hmm. Yeah, it's trying to take away their suffering or allow them to skip out on something that feels uncomfortable. Yeah,
you're trying to persuade them through logic that it's okay, and then you give in. And the second one, you push them until they have a temper tantrum, and then you give in. So the first could be the The helping trap. Maybe I don't get it right. I'm just trying to think about the cover of my book.
Yeah, your millions.
But Taylor, how do you work?
Cool.
I think the way I'd categorize it is the first is not allowing them to avoid a situation, like encouraging them to face their fear and help them get to do what they're afraid of doing, instead of giving them the quick out of like, oh, you don't want to go to the birthday party because you're uncomfortable, let's go home. So this is kind of like being there with them and helping them.
The first is the quick out, and the second one is the escalation trap.
Right. Avoid the escalation trap. Avoid giving in. Out. Right. Avoid giving in when the behavior is at its worst.
Yeah.
And Taylor, do you come across with resistance from the parents when you're teaching them how to stop the errors that they're making in these two examples?
I think a lot of there's always resistance in different ways, but I find in general that learning about your behavior and learning that you're doing these things is really helpful. So I actually find that parents are pretty amenable to wanting their children's behavior to change. Mm-hmm. And so if they figure out that they're doing these things and it's leading to worsening of symptoms in general, I find that my patients' parents are pretty amenable to not doing this. I don't think anyone wants their
that's awesome
kids to continue.
Yeah. Now, how do you explain that they don't resist you, the parents?
How do I explain the principle, or what do I do in my therapy so that parents don't resist me?
Well, it could be that last thing. Yes. Second thing.
I use your 5 secrets of effective communication, David,
okay.
And I build a trusting, empathic relationship with parents, which I find enables them to trust me and want to listen to what I'm saying. And I do a lot of, in your words, sitting with open hands, that I say, if what you're doing is working and you think the strategies that you're using are bringing out the best in your kid, that's awesome and great. And you should totally keep doing that. But if you're feeling frustrated or stuck with your child, here are some different strategies to try.
So what you're really saying then, that as a pediatric team therapist or any kind of therapist, you have 2 very different patients with different sets of needs, and you really have to be treating both of them and make the assumption from the very beginning that you're going to have two targets that you have to do therapy for, and you can't assume anything reasonable from the children or from the parents. Hello. In other words, you can't just rely on either party to be functioning in an effective way.
Correct. Well, our goal is to help them function in that way and figure out where the errors are.
Exactly.
Yes.
That was a great question, Rhonda.
Thank you.
I really liked it, and a great answer too.
Yeah.
Is there a third error that parents make?
I think, let's see, what would my $1 million...
It doesn't have to be related to anxiety. It could be related to any problem with children, because I think, parents will hear the podcast and will be eating up these tips.
Yeah, I'd say the last tip that I feel most passionate about, and probably most common error as a parent, is focusing on the negative, right? It's really important to teach positive talk and to try to catch the kids when they're doing the right things, and pointing out what they do that you like and that you want them to continue to do, and what you feel proud of them for. Because I think teens and children are suffering so immensely. I think the latest statistic is 25% of children are suffering with an anxiety disorder.
Oh my gosh.
And, it's really heartbreaking. And so parenting is a really hard job, and hats off to all the parents out there and those that help the parents. But I think we tend to get caught in focusing on the negative and what they're doing that's wrong or bad. And so if we could catch them being good and focus on the things that you love that they're doing, that you're proud of them for, and build a warm, loving relationship with them, I think that's one of the greatest buffers against childhood anxiety and depression is a warm and loving relationship.
That's huge what you're saying right now. Now, could that work for adults as well?
Absolutely.
Because in our app team, we developed all these lessons, and we have the full-blown AI now. It's getting pretty cool.
That's awesome.
But it was really a crushing blow to us about 6 months ago when we finally started getting funding for our app, and then we had fancy attorneys to ask questions, and we found out that if we want to sell it right away, it has to be a wellness app, not a prescription thing. It takes years to get something approved as a prescription device by the Food and Drug Administration, and that we had to follow all of these rules in the app. That we couldn't use the word depression, we couldn't use the word anxiety. I couldn't let on that I'm a psychiatrist because that's promising a cure for all mental disorders. I don't know how anyone could get that psychotic delusion, but that's apparently what the Food and Drug Administration claims. And so we had to rewrite months of scripts that we developed, go through them and change wording. And some of my best videos, they said, you can't possibly show this video. A lot of highly restrictive, irritating rules, but the idea is to protect the general public from frauds and con artists and the like, I guess, and that's important. So I was pretty angry about it and pretty crestfallen and frustrated. And so there's this woman, Teresa Abrams, who was kind of legal expert, but she's just works on our app team. She's not an attorney, but she has a good feeling. She used to be a paralegal, and so she goes through. She and I edit together, and so she would be saying we can't say this word and we can't say this word, and I'd be getting really frustrated and pissed off. And then I'd say something. She'd say, "Oh, brilliant, David. That's fantastic." And I'd say, "Oh, really?" And all of a sudden I'd start getting real warm and cooperative. And then I've started doing it to her when I'm trying to get my way about something. "Oh, that's brilliant, Teresa." But it's amazing how mood elevating that can be. And I've started doing that a lot, even in my elder and half demented years. I'm still learning, and I just think that's such a positive thing. Can you or Rhonda comment on it a little bit more? How the positive impact of treating people with compliments and stroking and praising what you like about them. I mean, that's what positive reframing is, really.
Absolutely.
I mean, there's probably isn't much more to say about it, but if someone could think of something to say about it, it would be great, because we have another 7 minutes to fill on the podcast.
Absolutely. One thing I will say about it is from a teaching perspective, showing someone what is good and desirable and how to be successful feels much more attainable than focusing on the hole that you dug yourself. When a child is really upset or acting out or being mean to a sibling, to constantly berate them or say, like, "Why did you do that?" or "What is going on with you?" or "What's wrong with you?" That's really hard for a child who's dysregulated or upset to figure out. Kids don't know how to answer why questions. If they knew why they hit their sibling, they wouldn't hit their sibling. But if you catch them in a moment of, "Johnny, I love how you took a deep breath, even though you were feeling upset, and stayed calm when your sibling hurt you," or, when you were upset, really enjoying being here at the table with you. Those things bring out the best in a child versus when us as adults are upset and frustrated, and just kind of focus on what's unacceptable or what's not going well.
So would this work well? Is this what you're talking about? You could say, why did you do that, you little brat?
I think you forgot, you little brat and you idiot. Then that you would get it.
Yeah.
Taylor, what I hear you saying at that dinner time example is that you're praising, or not hitting your sibling, you're praising their effort in what they're.
Right. Yeah, I saw that you said something really sweet to your sister, and shows me what a loving person you are, and I bet she really loves it too. Things like that. Just simple noticing positives in the other person and letting them know how much you appreciate that. And we sometimes underestimate the influence of parental love and positivity and reshaping behavior. Now, I have another question for you, a really hard one. Is that an awful lot of parents are at odds with each other, and I suspect that can sabotage a lot of your efforts to help the children, that they're arguing about the best way to interact with the child. And how do you deal with that issue when you're dealing with the parents? If they're both on the same team, I think it's incredibly helpful.
Yeah, probably parents being on the same team is probably more helpful than any dose of therapy I can give them.
Yeah, but they did a study of that recently, and they only found 4 sets of parents in the United States who were on the same team. But I'm sure you see a lot of that, or only the mother is involved with you and with the child, or only the father or something. And I don't know if you have any, your words of wisdom in these other areas have been so simple and illuminating. It's amazing. But what would your words be in that area? What do you as a therapist do or think when you have two parents that are kind of at war with each other, and mommy says that Johnny needs more love and daddy says that Johnny needs more discipline and so forth? And they're arguing a lot and fighting over Johnny.
Yeah, well, I mean, first of all, obviously couples therapy, if they're willing to work and improve upon that, could be helpful. But I think what can be even more helpful than that is setting realistic and attainable goals. So not expecting the parents to be on the same page 100% of the time, but really seeing, like, when you're at the dinner table, can you sit next to each other and support one another, right? Set like very concrete, specific times where parents are going to get along, and taking disagreeing off the table, or having one parent talk while the other parent says, I agree with what daddy's saying, or I agree with what mommy's saying, so that they can at least fake a unified front, because kids are masters at wiggling themselves in between parents, and they'll take advantage of parents that are disagreeing. So
I love what you're saying, that if they'll sit down at one point and decide to work together right now, support each other right now, they might like it, and the positive impact that has, and that might kind of addict them to doing that more often, rather than doing it in some global way.
Yes.
That's great. You did it again. You hit it out of the park again.
Thanks, David.
Yeah, that was really rich and helpful. Taylor, I love that.
Awesome.
It was positive also.
you guys are awesome. It's so fun to hang out with you and be here.
It's really fun to just have you just talk. It's like free associating, and it's just clear how much knowledge you have about working with teens and working with children and working with parents, and all of the kind of mental health suffering and improving their lives. It's really helpful. I can see the benefit that people who work with kids a lot would get working with you in a monthly consultation group.
Thanks, Rhonda.
Yeah.
What is your average duration of sessions? I'm sure it varies greatly from situation to situation.
It does. That's very true. It does vary from situation to situation. In general, I'd say if parents are engaged in treatment and their child's working, 12 to 15 sessions, I really try to give children and their parents a tool set and a skill set. We didn't even cover some of the skills I was going to talk about today to help with anxiety, but really giving them tangible skills and ways to change the specific thing that they're working on, and then ending treatment, because I don't want especially children to think of themselves as lifelong patients. I want them and their parents to feel empowered to work on the specific issue they're having, whether it's testing anxiety, trouble having a sleepover, difficulty regulating their emotions, really having things that they feel like they can learn and practice and then move on with their life.
Mm-hmm.
Great. Awesome. One other question would be, tell us just a little bit about your center now. Like you're working with some therapists who collaborate with you, and how many are there? What kind of setup do you have now?
Yeah, so I'm the director of the Feeling Good Institute in New York, and we have myself and then 3 other therapists and one unlicensed therapist who's in training, and we specialize in both treating patients as well as providing high quality training to therapists that want to improve their team CBT skills and become better therapists.
And do you see people in person and virtually?
So I'm starting again to see a few patients in person, but myself, I'm largely virtual. And then the other therapists at the center do a mix of in-person and virtual.
And children can work with you virtually, really?
Yeah, I've had great success. Yeah, it's been shocking. I keep saying I'm going to go back in person. I'm going to go back in person. And it's just been super effective and helpful in utilizing technology. And I think virtual therapy is here to stay. I think there's definitely a time and place for in-person, and I try to meet my patients in person from time to time, but I find that virtual is very effective.
Now I have just one last question on,
Sure.
safety in this era of COVID, because I know that was the topic of one of our previous and fantastic podcasts that I remember vividly, and you were so beautiful, and that was there. You were profoundly worried about COVID, and your wonderful husband, and he was there giving his all, and had to be living in a separate apartment to protect you folks and all of that kind of thing. And you were so beautiful in that podcast. But do you wear your mask when you're doing the virtual therapy?
I do not wear my mask in virtual therapy, which is one of the reasons I love it, is because it just you can still connect and see
exactly.
Exactly.
Yeah. Wow, it's been so great seeing you, Taylor. You're just doing beautiful, simple, understandable work. I love it, and I'm so proud of you, and so happy to be seeing you and your joyous, happy face, and it's really cool.
That's really sweet, David. I owe it all to you and your wonderful teaching.
That's like on that one hike.
Yeah, exactly.
Yeah, cool. Well, Rhonda will now pull this all together with an incredibly emotional, moving, and inspiring and brilliant comment.
I was saying that there's so much value in coming to your monthly consultation group for team therapists who want to learn and grow about working with kids and teens. But as soon as I said that, I thought, what am I talking about? The kids and the teens that work with you, they are so lucky and blessed to have you as their therapist. And I love how you said, get the therapy, get the learning, make the changes, and then move on and live your life. I don't think kids or adults need to be in therapy for the rest of their lives. And I just love that that's your focus.
I love what I do, and I love working with children and teens, and I just want to see an end to children and teen suffering. So I think this is the path forward.
Learning this from you now at this age will really put them on a path of mental health for the rest of their lives. It's awesome.
Thank you. Thanks for having me.
Well,
Thanks for taking the time.
Please give a nice David virtual hug.
With my mask on.
And kids, yes. Yeah. No, I forgot to put my mask on too.
I hope I don't get sick.
Yeah.
Okay, see you later.
Bye, guys. So
See
good
you,
to
Taylor.
see you. Thank you so much. Happy New Year.
Happy New Year.
Yes.
Bye.
Happy holidays. Happy New
Thank
Year.
you.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.